True, exactly. Like I mentioned just now. So this is a precursor. Before the heart problem comes, the penis problem comes first. So you can sort it out at the penis problem. Maybe it would not progress to a heart problem.
Now, there are some methods, simple methods to improve this. Now, we're going to show you some pictures and some slides. Can you talk us through this? What are the methods, the most simple methods actually, before we go to the mechanical part? Can we go to the medical part? What are the ways to actually solve ED? What are the easiest ways?
All right. Okay, so like I mentioned just now, sometimes there's predisposing causes to it. So I'm coming back to smoking again. We know for sure that people who smoke will have erection issues, and if they stop smoking, and over a period of time, we can see that the erection may be able to improve. That is one. So all these modifiable factors has to be modified first. If the person has diabetes, good control of diabetes has shown to improve erection. If the person has high blood pressure, by controlling hypertension, we can see that the erection improves. Same thing with cholesterol levels. High cholesterol levels with no other symptoms except for erectile dysfunction. You control the cholesterol levels, the erections have a chance to improve. Obesity is also a cause. By losing weight itself, most people's erections can improve. Activity, physical activity. So if you do lots of physical activities, which will improve the blood flow in the body, which will also improve the blood flow to the penis, and erection automatically improves as well. So all these modifier factors has to be modified first. Then we come to medications, all right?
So you're saying stop smoking, stop drinking?
Well, alcohol is a lesser factor than smoking, but of course, and it's moderate alcohol.
People say alcohol improves erectile, Is that true?
I think because when they are drunk, everything looks improved.
Everything looks improved. So, stop smoking, reduce weight, and exercise.
Yes.
That's simple enough. That's like taking care of your heart, right?
True, exactly. Like I mentioned just now. So this is a precursor. Before the heart problem comes, the penis problem comes first. So you can sort it out at the penis problem. Maybe it would not progress to a heart problem.
Right. This is something this is mind opening. If you solve the penis problem, you might have a chance to solve the heart problem.
Might.
Okay, that is fantastic. So what is that wonder pill, Viagra? Now before Viagra, there's something that I sold last time as a rep. It's called the Muse. Can you tell us a bit about the Muse?
Alright, yes. Before Viagra came into the market, there was this thing called Muse. It's called a medicated urethral system, where it comes with a mechanism where you try to put in a small pill through where you pass urine. I can imagine it not to be a comfortable thing to do. So you would have been difficult for you to be a salesman selling this thing.
Oh, of
course. But I can say that. But I can say that once you put the pill inside the where you pass urine, the urethra, it does give quite good erection for people with erectile dysfunction. It is a medication that actually works, but it's a little bit uncomfortable to put in. So in a way, it has lost the market out as soon as the magic blue pill came into the market.
Yeah, the magic blue pill is Viagra. I still remember the first year I joined the company. The sales director told me, you know what, we're going to outsell the magic blue pill. In my heart, I say, you can forget it. How are you going to put something in the small mouth than the big mouth? People would rather put in the big mouth, right? The small mouth down there. So within 1.5 years after I left the company, the product stopped production. Gone. Yeah. Muse is gone. So tell us about Viagra. Viagra, is this such a wonder pill? If you take it long term, will it give you problems or not?
Right. Okay. So Viagra, I'll tell you something about Viagra. Actually, when the company came up with this Viagra, they were not actually looking for a drug for erectile dysfunction. They were looking for a drug to control high blood pressure, hypertension. And during the testing phases, they found out that when people take this drug, their erection improves. So instead of concentrating on the blood pressure, they decided to concentrate on the erectile dysfunction, and that's how the magic pill came about. Okay, so Viagra is, of course, there are a few other medications in the same group, but the first one and the most famous one is Viagra. And well, it works And your question is whether people will get dependent on it. Yeah, the dependence is not really because of the drug. It's because the person already has erectile dysfunction and looks like he may need medication. And once he's taken this medication, he will feel that the erection has drastically improved. And without the medication, the erection is not going to be there. So in that way, he may become dependent to the drug, but not because the drug is like an addictive dependence. The other thing is whether it will become no, meaning that it eventually may not work because the person gets desensitized to it. But as long as the other parameters in the person is all right, the drug is expected to work as long as it can, meaning that he can continue to take for many years without issue.
So as long as the person don't go non-sensitive to the medicine, it can go on and on and on. So
correct.
The blue pill, of course, is the most famous erectile dysfunction drug. There is another two more drugs in the market, right? It's called what, Cialis, and the other one is
Levitra. These are the
Levitra.
3 famous ones.
So which is better out of these 3?
Right. Okay. So there are lots of researchers comparing all these 3. So all three work. It's just that sometimes you need to individualize certain medication, meaning that some medication may work better in one person compared to another person. Having said that, big difference between Viagra and Cialis is that Cialis lasts much longer in the blood, meaning that the research shows that it's supposed to last about 36 hours in the blood. So the person can have a wider window for him to plan for a sexual activity, meaning that if you take this drug for the next 36 hours, you may be able to get good erection with the effect of the drug. Whereas Viagra is expected to work maximum for about 12 hours. So they have to plan for the activity before they take the medication, otherwise it's a wasted medication. So the longer window could be good for some people, but some people may prefer a faster acting thing that Viagra claims they have. So it's a very individual thing. So some people try out one after another before they choose this is the best one for me.
So to put it in a nutshell for a consumer like us, so if you want action tonight, Viagra. If you want action anytime within the weekend, Cialis, correct?
True. On top of that, Cialis also have another variety where you take a lower dose, but you take it every day. So you can be ready for action any time of the week.
Okay.